Yeah. So we go back to the slide about family history and social history. And yes.
Unit 6.
And so we are going to listen to the same information one more time. And so you should write down in note form the questions the doctor asked in each case. So do you understand?
Yes, ma'am.
Okay. Well, and now please take notes.
Unit 6.
Can you
Listening
hear?
1. 1.
Yes, ma'am.
Yes, ma'am. It's audible.
Okay.
Unit 6. Listening 1. 1.
What about work? Do you have any problems there?
At the moment, yes. It's a bit stressful.
And can you tell me a bit more about this?
Well, I'd say it started about 2 months back. A colleague resigned and he wasn't replaced. So I'm kind of doing 2 jobs at the moment.
2.
Are your parents still alive and well?
My mother is, but my father died 3 years ago.
Do you know what the cause of death was?
It was lung cancer.
3.
Do you smoke at all?
Yes.
How many do you smoke normally?
I'd say about 20.
When did you start smoking?
I had my first cigarette when I was 15.
15. OK. And have you ever stopped?
Yes, many times.
When was the last time?
I quit last year, but it only lasted a month.
Okay. So did you write the questions?
Yes, ma'am.
Okay. So what are the questions asked by the doctor?
The first one is what about
What
the work
about-
problem, ma'am?
Work. What about work? Do you have problem?
What about do? Yes, ma'am.
The second one is
Yes.
your parents
Are
still
your
alive, ma'am?
parents still alive?
Are
Are your parents still
Unwell.
alive? Do you know what was the reason?
The reason.
Do you know what's the reason?
The cause. Okay.
Third one is why do you
Smoke a lot.
Do you smoke? How often?
Yes.
How many times you smoke?
Did you
Have
ever
you ever
stop?
tried to quit? When did you smoking?
Oh, the connection is bad. I see. Okay. Well, anyway, so we remember the questions. And what tenses are used in these questions?
In the first one, it is
Yes. First, the doctor starts with which tense? Is it as far as this is about the present
simple
situation?
tense.
So
Yes,
simple tense and present
Present
tense.
tense.
Yes.
Simple
When the
present tense.
doctor
Simple
was
present.
asking questions about the parents, what happened to the parents' father, he used which tense?
And that too.
Past simple.
Simple.
Past simple tense. Yes, about
Past
past
simple,
tense.
yes.
Yes.
Simple.
Yes, ma'am.
And when the doctor was speaking to a woman who is smoking, so he used present,
Present simple.
present, and about how long. When he asked how long,
Past simple.
that was present perfect tense, right? So when we speak about the event which happened in the past and is still going on, it's better to use the present perfect tense. Okay.
Yes, ma'am.
Well, and So the question, what other questions can you ask about these topics? So home,
Excuse me, ma'am?
occupation, hobbies, alcohol, about money problems and changes in habits. So
Ma'am,
yes,
you're on the same slide.
the same slide.
Yes, ma'am.
I see.
24th number slide. You're on that slide.
Mhm. So let us try to stop sharing. Then share it one more time. Mhm. What do you see?
Yes, ma'am. Now
Yes,
it's
ma'am. Now it is changed.
Slide, yes. The previous slide. Mhm.
yes, ma'am. Visible. No.
Okay. good.
Visible.
Mhm. So other questions about the topics which are here on this slide? Home, occupation, hobbies, alcohol, money problems, and changes in habits. If you are a doctor and so what questions can you ask about home? And why is it important to know about home?
How is the environment of the home? Also, if there if
If
there
it's your health
any problem, any disease,
or social,
hereditary,
psychologically.
So if a patient has any diseases, so what should you find out?
they can predict that
History for that.
might
Even we can trace the disease from
problem.
family history now. Like some diseases
Yes.
are carried from heredity.
Inherited.
Hereditary. Sorry.
Inherited, but this is about
Yes.
family, right? And why is it important to know something about home where the patient lives? Mhm.
Actually, the
It affects
patient.
here like if he lives on like neat and clean places, so it will influence his work and
Like if the patient lives near some industrial areas and all, ma'am, he may be suffering from respiratory diseases and all.
responsibilities.
Like we can predict, ma'am.
Mm, I see. And what are the questions? Yes, Samhita.
Yes, ma'am. Actually, when we talk about home, we can also figure it out that if someone right now is suffering from the same disease,
Exactly.
maybe it can be some congenital virus or some bacterial infection.
What is the exact question you are going to ask the patient about his home? Say the question.
Is there anyone at your home suffering from same problem?
I see. Okay. Good. So, or do you live alone, or how big is your family?
Has anybody had the same problem before?
In your
At your
family?
home.
Yes. Okay. About occupation. What are the questions
It
about?
is important because like in industries, like people who work there, they may suffer from respiratory disease. Like
Also
their
in
work may
occupation,
affect. Yes,
Ma'am,
occupation.
we
person
can
might
ask
have
what
some
do you do
mental
for a living?
like stress
Yes,
or
ma'am. Occupational
Yes.
disorders.
Okay. So
We can
about
ask what do you do for a living, and then we can ask how stressful is that, or
exactly.
are you? Yes, ma'am.
Why is it important to know something about hobbies, patient's hobbies?
ma'am, because they determine two things. Number one can be the stress that the person is suffering from, and number two can be the environment of the office. If it's an industrial area, if the person is working somewhere, sea, or maybe he is
Hobbies.
working.
Ma'am, hobbies are
Hobbies,
always,
she's asking.
ma'am, hobbies are not always good.
Not
They
always
can be
good.
bad.
Mhm.
Yes, ma'am. Hobbies can be bad sometimes. If the patient is
They are,
much stressful, they can just
they
go
are the
to
main act
go
of
to.
lifestyle, ma'am.
Yes, ma'am.
Exactly.
He's
Based on
basically
the
tells
hobbies,
us
the
about
health of the patient
our
depends, ma'am.
So it's
lifestyle.
They
important to
may have like
know
habits of.
in what kind of activities patient is involved.
Yeah.
I see. And why do people just have hobbies? What does it help them to do?
Hobbies help them relieve their stress so that they can do other stuff other than their routine work.
Yes.
Routine work.
Sure,
Yes.
to overcome stress. Okay, so about alcohol, why should the doctor know about alcohol?
Like consumption of how the patient is consuming the alcohol is important. Like if he's
Alcohol have
taking
so
too
many
much
side
alcohol,
effects, so that
yes,
the doctor may know that
wrong.
if
Addicted
person
or
is
not.
suffering from any problem, then if he or she drinks or not, how often they drink.
Lots of alcohol.
Also,
For
ma'am, there are
example,
some
if the patient complains about something about the liver, ma'am, we can predict that.
Mm.
We can ask him if he drinks alcohol or not, if he consumes
also,
alcohol.
Because it can cause these problems. Yeah.
also, ma'am,
Okay.
there are some
Yes.
there are some medicines that cannot be taken with if you are drinking alcohol on routine basis.
Exactly. This is
So,
very important to understand. Yes. And to tell the patient. Okay. So why is it important for the doctor to know about any money problems, financial
Like
problems?
if the patient have money problems, like they will anxiety, like they may have any depressions, they may suffer from depression. So it will eventually affect their life and their like health.
Anyway, so if a doctor prescribes something to the patient should be able to buy these medications,
Yes,
right?
afford like
Yes.
afford the medications.
Okay. Does anyone else want to say something? I see. Okay. So now, please, for just several minutes for you to write the questions themselves, the exact questions that you would ask a patient if you were a doctor about these 6 topics. So please, everyone, I'll give you 5 minutes to write the questions. Start, please. Well, are you done?
Yes, ma'am.
Mhm. So let us work like, so one person just asks the question and says which student this question is addressed to. And then the next student should answer the question and also ask the next question, okay? Like in a chain. So let's start with Arun Chalam. So please, your question about home.
Ma'am, okay, ma'am. So now I have to say somebody, ma'am, to answer. Have to mention.
You should ask first. Ask the question, please.
Okay, ma'am. Who are the oldest members of the family in your home or in your house, like that?
Will you repeat, please?
Who are the oldest members of your family that you knew personally, like that, ma'am?
Okay, and name the
oldest.
student. Name the student who should answer your question.
Ma'am, I asked to Nishat, ma'am.
Mhm.
Yes. Like my eldest member at my home is my grandfather.
And so why do you ask this question, Arun Chalam?
And also the next question is,
I mean, why do you
do
ask the question about the eldest person in the family?
yes, ma'am, because ma'am, because from the elders only we get the basic the heredity things, ma'am, like that, all the things, ma'am. So if they have any particular instinct like hereditary, that hereditary thing, it may pass to the next generation, ma'am. So to confirm that, who are the oldest members of your family, and do they suffer from any
I see, okay.
side
Yes.
effects, hereditary
So,
disease?
Nishat, will you just ask your question?
Yes, about occupation, ma'am.
Okay, yeah. Mhm.
Yes. Like, what is your occupation, or like, did your occupation has taken part in your illness?
So who do you ask the question? Which student?
Amen.
Mhm.
Ma'am,
Yes.
like, if I can say with my perspective, I'm just a student, and about illness, yes, it has affected my health, or
Mm.
like in some aspect, like it's a bit stressful sometimes.
Okay. Yes, your question, please.
My question was, what do you do for a living, and
What
is
about
there any
hobbies?
stress at work?
Let us move to
What, ma'am?
hobbies. Mhm.
Hobbies? Yes, ma'am. I can ask, what do you like to do in your spare time, or
Okay.
what are your hobbies?
So, the name of the student?
I'll ask Prerna.
Yes, ma'am. So my hobbies are I like to read and I like to sing in my free time.
So it helps you to relax, right?
Yes.
Yes, ma'am.
Mhm.
I
So
can also ask
yes,
if you like to do some exercises or something in your free time.
physical activities. Mhm. Yes,
Yes.
Prerna.
I do very less physical activity as I'm much busy with my work. That's why I'm
Mm.
not in physical activities.
So it also influences the state of your body. Yes, your question, please, Prerna.
Uh, do you drink, and how often do you drink?
Who do you ask?
Uh, I would like to ask Samhita.
Mhm.
No, I don't drink. I stay away from alcohol.
Mhm. Okay, so your
How
question?
often do you drink? Or okay, you don't drink. So okay, that's cool.
Mhm. Yes, Samhita, your question.
Money problems.
Mhm.
Do you think your monetary aspects of the life have increased your stress level? Ma'am, I would like to ask this question from Rafael.
Mhm.
Uh, I think I'm financially stable, so I don't think it's. I'm just financially stable.
Okay.
Okay, so the doctor is satisfied with your answer. So, Rafa, your question.
Yes, ma'am. Did you observe any change? I would like to ask Prakriti, ma'am.
Mhm. Is Prakriti
No.
here? Yes. Mhm.
Yes, ma'am. No any change in my habit because it could.
No changes. Yes, the doctors ask about changes because they can influence, that they can cause some problems with health. Okay, so this is the way we should just learn something from family and social history when we speak about the lifestyle of our patients. And so let us have a look at this chart. So in this chart, you can see some habits, and let us choose two things which you yourself find difficult to change. And you may rank each choice on a scale of 1 to 5, where 1 is easy to change and 5 is very difficult to change. So, for example, I would choose like snacking between meals. So which is unhealthy, I understand this, and it is difficult for me to change because I'm working online, and so food is always available, and so I think it will be like 3. The difficulty of changing this habit is 3 for me. And I would also choose like not doing exercise. So, and this habit, it is difficult to change for me, but it's not very difficult. Like I would just give 2 points to this of difficulty to this habit, because I can force myself to do some physical exercise. What about you, my dear students? So let us listen to Madhumita. Are you here? Mhm. What about Divya?
Yes, ma'am.
So what would you choose?
Not doing exercise, ma'am.
And how difficult is it for you to change?
It's very difficult to change. 5.
And the second habit?
Snacking between meals.
And so which number difficult?
Number 3, ma'am.
Number 3, I see. Okay. So the other students who would like to comment on this chart?
Can I?
Your name?
Prerna.
Prerna, please.
I can't just drinking tea. It's very difficult for me.
Will you repeat? The connection is
Drinking
bad.
tea. I drink tea a lot, so I cannot resist. So it is 5. So it is very difficult. And
what else?
Also not doing exercise.
I see. And how?
On a scale of
I see. Okay, thank you, Samhita.
Eating chocolates, ma'am.
Really?
Yes, ma'am. I'm still addicted to chocolate. I can give it a 10 out of 10, but this chart just give me an option for giving it 5.
I see. Okay. And what else?
That's it, ma'am. Rest I can go on exercise. I don't smoke. I don't know how to drive a car. I don't drink sugary drinks. I do drink coffee, but it is at times actually. So only chocolate is something that's bothering me.
I see. Okay, thank you. And who else was there like to raise a hand? Only one person, right?
Can I?
see. Your name?
Nishat, ma'am.
Nishat, please.
Like first one is, ma'am, like not doing exercise, ma'am. I would scale it like 3, ma'am. And like eating chocolates, ma'am, like if I have too many chocolates, I eat a lot at one time only, so it is difficult. I will give 4, ma'am. Fine.
Yes,
Ma'am,
and
can I?
yes, please.
I would like to go with avoiding stress, ma'am. Ma'am, avoiding stress is very difficult for me. I get stressed out very easily, ma'am. Since we have much pressure, ma'am, about the studies and all, ma'am. So I would go with 4. It's very much difficult.
I see. Any other habits?
Yes, ma'am. About drinking sugary drinks, ma'am. I consume a lot of sugary drinks, ma'am. That too much on a regular basis, ma'am. So even that would be difficult for me to leave. I would rate it about 3, ma'am. 3 to 4.
I see. Okay. So you see that we focus on these habits in our lifestyle because they are negative and they just influence our health in a negative way. So that is why we should focus the attention of our patients on some harmful lifestyle habits. And the question is, decide which, if any, fit best with ranking you have given for each choice. So the phrases which are given here, you should match them with some just harmful habits that we've have just discussed. So, I see.
For eating chocolate, ma'am, it should be 4, ma'am. When I try to give up something, 4. When I try to give up something like eating less chocolates, I tend to do it even more. Suitable to that.
Okay. So, what other just phrases can we also use?
Yes, ma'am. Snacking between meals.
So, and which phrase can we use which are presented to the right?
I know it's bad, but I enjoy it then. 5.
Yes. Okay, and
for avoiding stress.
What is it?
It's
like,
impossible
for me to change at the moment.
Yes.
Second one.
Yes, because sometimes it doesn't depend on the person.
It may depend on the situation.
Drinking fizzy sugary drinks.
Which one?
I want to change. I just have to make the effort.
Yes.
Yes.
I would.
It's bad. Avoid it.
Yes. Yes. Okay. So as for me, I would choose. I want to change. I just have to make the effort when I speak about not doing exercise. So
I just for 7, not doing exercise. I want to change. I just have to make the effort.
Yes. So when a patient understands the problem, so it means that he can start just changes in his life. Okay, and so if we move to the next slide, so there are pictures here. And which do you think reflects your own attitude when people are trying to help you change habits? So somebody is telling you to change the habits about not doing exercises, eating chocolate, or drinking some sweet drinks. So how do you behave, like the person in the first picture or in the second picture, and what's the difference? How do
Ma'am,
people?
in the
Yes.
first picture,
Yes.
ma'am, the attitude of that lady is like she's not ready to change herself, or she's not interested in change. And in second picture, the person is showing great interest in listening to their advice, and
Okay.
it seems that they are in
And
second
change the
place it is
habit.
possible to change
In
their
the second
habits,
picture, we can see that the patient is much encouraged.
encouraged and active.
Also, in the first picture, we can say that the lady seems that she's doing right. She don't need any advice. It seems that
Mm.
she has
Yes,
such
ma'am.
kind of attitude.
She's
And the
giving
Also,
a
second
good attitude
Samhita,
towards the
please.
doctor.
yes, ma'am. Also, in the first picture, we can see the lady is very carefree. She is not aware of the consequences it can hold for her health.
I see. Maybe this is the reason why she doesn't want to change her lifestyle. Okay. So, and the question, why do you think it is necessary to consider patients' beliefs, emotions, willingness in helping them to change lifestyle habits?
Because changing the lifestyle is helpful for them, not for the doctor. So if a doctor is helping them, then they would like the patient to give more efforts and more willingness to what doctor is saying. So it will be effective
I see.
to the patient.
I see. Any more ideas? Okay.
The second person, like, he
Huh?
can change his habit if if the doctor has given some advices. He's willing to do as he's
Yes.
showing response.
And the doctor should be aware of the patient's situation, right?
Yes.
About what he believes, what he wants in his life. Okay. So there are some words for us to. Okay, let's just postpone it to some later time, and so I would like you to focus on the home assignment. So this time you should find the site, which is the name of the site is given here, netlanguages.com, and we'll try to do some part of the course, online course, which deals with the healthcare. You should sign up for this site. So you should follow the link and sign up. Then you should find the course for individual students, like it's given here. So in the picture, course for individual students, and if you click, you should find you'll see online English courses for adults that are available on this site, and you should choose medical English for health professionals. Then, after you've clicked on this line, you'll see this window, and you can see that only several lines are clickable here, and you should click on this line, like basic, intermediate, and advanced levels. If you do this, you'll see these 3 levels. And of course, you should click on advanced B2, C1 level. And if you are assigned, then you'll see the name of the course. Here on this slide, I have already started doing this course. That is why it shows that I've done some 21% of the course. So you'll see 0, and you click on this just a part of the site, and this is the available sample of the course, which is not paid. This is free of charge, only part of the course. And then you'll see the content of the course, and some modules are available for free, and you should click on these clickable modules like taking a medical history and do the tasks in this module. And you can see the timeline here. There are 14 just units, and you should complete number 1, number 2, and number 3 units from 1 to 3. And you should do the exercises in these units, and you should send me the screenshots after you have finished. For example, unit 1, it's rather short. You just take the screenshot and just insert it into PDF file, and you should upload it to Moodle site. So when you have finished, it just shows there is a green line above the unit. So unit 1, unit 2, the screenshot from unit 2, and the screenshot from unit 3. So this is the task for the next class, and you should submit it. The deadline for this task is Saturday, as we usually